After a year of debates, protests, and deal-making, Congress has passed a health care reform bill. 216 Democrats in the House voted in favor of a bill that would extend coverage to 32 million Americans, ban insurance companies from denying coverage based on pre-existing conditions, and cost an estimated $940 billion over 10 years. For more analysis, we're joined now by David Mark, senior editor for Politico. Good morning, David.
Hey, good morning. Good to be with you.
Good to have you here. We've been talking about this for a long time. This is a historic evening, isn't it?
Right. It's hard to believe this measure has actually passed. It's about to become law. It's been fought over so intensely. And these changes that you just described in the healthcare system are going to be major, and a lot of them are going to be immediate. They're going to take effect just in the next few months.
As we watched the moments leading up to the vote, it got very contentious. Explain to us the heated discussions going on down on the House floor and everyone making their last statements before the vote.
Right. The fact that this bill passed only 219 to 212 shows just how closely divided Congress was. That's only 3 more than was needed to pass this thing. It shows why House Democratic leaders were pushing so hard on Congressman Bart Stupak to come to a deal. He, of course, is a strongly anti-abortion Democrat. He held the cards, and the House leaders apparently realized it. It led to a lot of really raw emotions. Usually, members of Congress are reasonably civil to each other in public, but here they were kind of shouting epithets at each other, and you could just really see the veneer of civility stripped away. And
we understand there was also a shout of the words baby killer. We're not sure at this point who that came from, and some of the people who do know don't want to say. Abortion, though, President Obama tried to take that issue off the table by signing an executive order, didn't he?
Right. It's pretty shocking to hear something like that, considering that Congressman Stupak was so vocally anti-abortion in the last couple weeks or so leading up to these negotiations. That's right, though. President Obama really tried to diffuse the situation by saying he would sign an executive order specifying that no federal funds go to the procedure of abortion. So that was supposed to take it off the table, but that certainly did not satisfy everybody.
The anger has also spilled out onto Main Street as well. A lot of Americans very angry, and I understand that some people who were some lawmakers who voted for this are very nervous when it comes to midterm elections.
That's understandable. It's already expected that several Democrats, maybe a couple of dozen, are going to lose their seats in November. So to put themselves on the line and vote for a controversial bill like this, it's tough. But then again, that's what these men and women are elected to do, to take tough positions, stick out those positions, and stick by their convictions.
How long is it going to take before we can see some of these changes take effect in everyday life?
We could see some of these changes go into effect really in the next 6 months. So some of the rules and regulations that are now coming down on the insurance companies, that they cannot not deny claims of people with pre-existing conditions, those take effect really by the end of the year. Some of the longer-term benefits we won't see until 2013, 2014. But some of the other measures, like people being able to keep their insurance if they lose their job, if they change jobs, that's going to take effect pretty soon. So there are going to be some tangible benefits, at least according to Democrats.
And then procedurally, in the near term, what are we expecting to happen?
There are still a few legislative hills to climb here. The Senate has to act on what's now called reconciliation, meaning they've got to take up changes to the House bill. The only reason this thing got through the House was because the Senate promised that they would then make changes. So there's a way to go, and it could get awfully complicated on the Senate side. It's not clear exactly how that's all going to come out.
All right, David Mark from Politico. David, as always, thank you.